Hi, I'm Dr Krishna. I am Clinical Director for Patient.info and also a working GP. We cover a lot of topics in our YouTube channel. This time we've got a new sexual health series where we cover topics such as gonorrhea to chlamydia to herpes. So please stay tuned with us for over the next few weeks while we delve into the topics of sexual health. This is our sexual health series, and today I'm going to talk about genital herpes. Now, genital herpes is a sexually transmitted infection. It is caused by a couple of viruses. The first one, HSV1, is that causes cold sores, and HSV2 is the genital herpes virus. Now, because of sexual practices, that can interchange, so you don't know which virus is causing it. But to be honest, all you want to know as a patient is that you either have or have not herpes. So what are the symptoms of genital herpes? Well, these are ulcerations, a little bit like a cold sore. So you can get ulcerations around your vaginal area, your vulval area, and on your penis. It can be really, really sore and painful to pass urine. So a lot of my patients say that they're in a bath and with a bit of warm water, and they can pee straight into the bath because it can give them a little bit of comfort. And it is, like I said, really painful. You can get some painful swellings around your groinal area. These are lymph nodes, a little bit like if you've got a sore throat and you get lymph nodes in your neck, you can get the same thing happening in your groin, and it's just indicating that your body's trying to fight off an infection. And because your body's trying to fight off an infection, you get all of those symptoms where you feel a bit tired, a bit fatigued, and also really a little bit flu-like you're just not quite yourself. In GP land, we don't test for it because a lot of the time we don't have the swabs that are specific for viruses, but we can tell you, as soon as you've told us a story and we've examined you, we pretty much know what the cause is. If you go to a sexual health clinic, they will test you because often, because of those open wounds, you are at risk of other sexually transmitted infections, so they would probably want to do the whole suite of testing to make sure that you're safe, and that if there are any sexually transmitted infections that are present, that they can treat them all safely and also contact people on your behalf so that you can remain confidential. If you don't do anything, that's fine. It will go away on its own in a couple of weeks, but it can be really painful, like I said. So we can give things like numbing agents, or we can advise you on sort of things like petroleum jelly to cover the area, to soothe it a little bit. Or we offer you antivirals, much like a cold sore, it's acyclovir, and we will give you a course of that, and that should help reduce the number of lesions you have so that you're not in pain for too long. Subsequent infections should be less. In fact, you might get away with 1 or 2 in your lifetime and then it might burn out. Other times people are a bit unluckier and they can get more than 6 bouts in sort of 12 months in a year. So if that happens, please go and talk to your GP. We can give you antivirals preventatively to stop these from reoccurring. Herpes is unusual in that it might be that you have had the infection for a long time within your body, but it's not surfaced. So the partner you're with now might not be the person that gave it to you in the first place. And it can lie dormant in you for years before it comes out as herpes infections. Now, triggers for herpes can be things a little bit like cold sores, like sunlight, stress, lack of sleep. If you've got any problems with immunodeficiency, such as needing chemotherapy for cancer, all of that can trigger a bout of herpes, or in fact the first infection. It's nothing to worry about. The treatment, like I said, would be the same as any other time, but if you want to know more, have a look at our patient.info website, have a look at our social channels, and please subscribe to our YouTube channel. Take care.